Hi. Today it's April. It's Monday, April 11, 2022. We're going to continue our teaching regarding disorder of the brain and nerves. And this video, we're going to gain some knowledge about encephalitis. As usual, before we start, let's read some spiritual words about health. I'm taking that reading from Prayers on Fire, page 81. Says that you have designed me to live a glorious life free from stress and worry. You want me to prosper and be in health, even as my soul prospers. Encephalitis, this is a disease of the brain, and the specialist people need to consult when you have that disorder is a neurologist. Neurologist is a doctor, is an MD who specializes in disease of the brain and nerves. So what is encephalitis? Encephalitis is a disorder of the brain, like the picture I show you. It's all the brain. It can be in any part of the brain. It's an inflammation of the brain tissue, usually caused by infections. Occasionally, we can have encephalitis can cause also by poisoning. If somebody gives somebody poison, so their brain, the tissue of their brain can be inflamed, which led to encephalitis. We have primary encephalitis and secondary encephalitis. The primary encephalitis can cause by viruses such as herpes simplex, herpes zoster, which is the varicella, mosquitoes, tick-borne viruses. The secondary encephalitis can cause by complication of a viral infection, such as mumps, measles, rubella. So thanks God, we have vaccination. The infants, when they are born, they got vaccinated against those disease, those infection like mumps. That's hot. That's the immunization they call the MMR for mumps, measles, and rubella. So that's why the children, before they used to have a lot of those brain infection, but because of those vaccination, the children they have it less and less. And chickenpox also. The chickenpox virus can cause encephalitis as well. So the causative infection, the virus who cause that can enter the brain through the bloodstreams. Encephalitis can be fatal, can be deadly. That's what that means. Fatal, can be deadly within hours of onset. So that can kill somebody quickly. But even though it's fatal, even though it can be fatal, many people can or may recover fully after that after that use attack. So if that person of that child go and get treated, uh, promptly, that person can be recover fully. What are the symptoms of encephalitis? Okay, we can find mild symptoms, and also we can find severe ones. So in mild cases, um, the symptom of encephalitis can be similar like other viral infection, like your flu-like syndrome, your flu-like symptoms can be fever, headache, loss of appetite, lethargic, like you're sleepy, or drowsiness. So you have difficulty to stay awake. In the severe cases, you can find double vision, mental confusion, impaired speech, depending where in your brain the virus is affected. Cause that inflammation of your brain. So we can find stiff neck and back, epileptic fits, and coma. So this is in severe cases. What is treatment for encephalitis? The treatment, this is a medical emergency. You need to go to the ER as fast as possible to get treated. So they will, get X-ray, get lab works, so they can know exactly what to do. And again, the specialist who's supposed to treat you for that, it's a neurologist. So now let's gain some knowledge about epilepsy. What is epilepsy? Epilepsy is again a disorder of the brain. Epilepsy, when somebody has an epilepsy, okay, so that's an indication that your brain function doesn't work well. There's something in your brain doesn't work. So they said it's an indication of an abnormal in brain function. Generalized epilepsy can be grand mal or petit mal. This is the most common form of generalized epilepsy, and this one is caused by a great electric called discharge across the surface of the brain on both sides. So it's really an electrical discharge. Sorry. So generalized epilepsy, grand mal or petit mal, is the most common form of epilepsy, and it's caused by a great electrical discharge across the surface of the brain on both sides. Partial seizure epilepsy, simple and complex, is confined to a localized area of the brain. So generalized one, it's all the brain, and partial seizure is localized. And often, but not always, the temporal lobe. The symptom may vary according which area of the brain is affected. So 1 in 100 people in the United States suffer from epilepsy. 1 in 100, that's a lot. And also 70% of cases cause are unknown. So we don't know what caused it, 70% of it. But study shows that genetic can be a factor, because usually we found that if somebody has it, somebody may have somebody in the family who has that also. The grandparents or the children, they can have it. So genetic may play a big role also. 70% cases started uh, dru- uh, du- during childhood. What are the symptoms of epilepsy? The grand mal. The grand mal symptoms can begin with a shout, loss of consciousness, for a forming of the mouth, like white uh, forming of the mouth, like soapy kind of. Um, a loss of bladder and bowel control. So when somebody has grand mal epilepsy, that person can uh, urinate and defecate too, on themselves. So this is not their fault, it's because of this seizure. And also you can find a rhythmic contraction of all the body's muscles. So all the body, is contracted. And the person may end the seizure with a deep sleep. After they have all those symptoms, the contraction, they pee on themselves, they defecate on themselves, and then that person can go into a deep sleep. Petit mal, it's more common in children. And the symptom in petit mal, we're going to find more momentary loss of consciousness, so they lost their consciousness, but they come back. So it's quick. Jerky movement of facial and fingers muscles. Um, and also, they can have a simple partial seizure. They can have hallucination of smell, vision, or taste, twitching movements. But the complex partial seizure, it's as for simple partial seizure, but with a feeling of fear and anger of a period of unresponsiveness. And also the person who suffer of epilepsy also may behave in a robotic-like way and can be violent if interfered with them. So we have to be careful because they are confused. They just have that epilepsy, and sometimes they're confused. They don't know where they are, so they can become aggressive and violent. So we just have to give them, reassure them that everything is fine. So we are there for them, and then they can calm down. Um, so what are the treatment of epilepsy? First of all, when they go to the ER, to the emergency room to see the doctor, so they are going to do uh, a test calling EEG for electroencephalogram. That test, what he's going to do is going to study the electrical charge, the electrical movement within that brain. So if somebody just have epilepsy, that test will show us, the provider, the healthcare professional, that yes, that person did have an epilepsy. So the EEG, that testing is there to to confirm indeed that individual did have epilepsy disorder. Um, we have several drugs we give. So the old drugs, it's like if you are on Dilantin, so it's for it's for epileptic seizure. There's gabapentin also they can give for that. Valproic acid they can give for that also. And also, when drugs fail to control your the seizures, surgery may be an option. Depending, surgery may be an option. The surgery will, they will do the surgery is to remove the affected portion of the brain, or to interrupt the pathways of seizure spread may be considered. Just to uh, interrupt the pathway. So that's why surgery may be indicated. For children now who do not respond to other treatment, um, the research shows that the ketogenic diet may be an option. So, ketogenic diet, this is a diet who is high in fat and very low in carbohydrates. Um, so um, so this some caution we have to do when someone has epilepsy. Never attempt to open the mouth or uh, force anything between the teeth of someone who is suffering an epileptic seizure. Um, okay, because that person can bite, or that person can break. If you're trying to put something, they can break it, and they can bite your finger. So never try to put you know something inside the person's mouth. And also, so what you can do also, loosen the person cloth. So if somebody has it, try to unbutton their shirts and ensure that he or she is not in any danger. And then wait until the seizure has run its course. Make sure that person has nothing they can hit themselves with. Their head has to be protected. So wherever they are, try to keep everything around that person free of items. Um, and also, repeated grand mal attack with no recovery or of consciousness, that require urgent medical attention. So me, I would say, even though it's grand mal or petit mal, that person needs to seek um, medical attention, because sometimes that person, is known having that disease, but sometimes they have to do lab works. So let's say that person is on valproic acid. Is on valproic acid. If that person has um you know an epileptical epilepsy attack, if he has that, the provider will order the lab works, and if the valproic acid, the level is low, So what usually we do, what they're going to do is to increase the dosage. So even though it's grand mal or petit mal, it's good that person seek medical attention so they can, reevaluate, the current treatment to see if they need to add more medication or they need to increase the medications is on. So on that, I hope you gain some knowledge for you or for your loved one who have that, because it's, I mean, we still have that, but thanks God now we have good medication, who can control the symptom of epilepsy. On that, I will stop, and the next time we still have more to cover on disorder of the brain and nerves. I wish you best of health next time. Bye bye.